And thank you very much, esteemed panelists, and particularly the registrants. I think we had over 800 registrants from so many different countries. So we're very happy to see you join us. I wanted to say that for the World Brain Day, the Brain and Mind Institute invites you to this conversation on how to understand and to nurture your brain. You have this brain that you're born with, and it's the same organ till the end of your life. And it's so important that we pay a lot of attention to it, because really it is probably, I may be biased, but probably the most critical organ that we are blessed with. I think that you will get to interact with some of the experts in the field across the developmental stages, child development, adolescent mental health, adult well-being, as well as aging. And this event offers you insights into what really shapes our brains and what we can do to protect it and to nurture it at every stage of development. So I was going to start out with the first panelist, which is a friend and a colleague of mine, Dr. Amina Abubakar, who is the director of the Institute of Human Development at Aga Khan University. She's a developmental psychologist with well over 20 years of experience, research and practice. She leads groundbreaking work in child neurodevelopment and mental health in low-resource settings. She's a recipient of several awards, including the Royal Society Pfizer Award, NMRC African Research Leadership Fellowship. She's a technical advisor to the World Health Organization, National Academies, and at Save the Children, Autism Speaks. She's very passionate about building capacity for the upcoming African scientists. The Institute for Human Development at the Aga Khan University dedicates most of its work in early childhood development, and we work very closely together, so I'm very happy to invite her to begin the presentation. Each panelist will have 10 minutes for their presentations, and then we'll move on to the next. The sequence is going to be Dr. Amina Abubakar, followed by Dr. Aisha Mian, and then we'll have Dr. Professor Mohammed Vase do the presentation. So without further ado, Amina, over to you.
Thank you, Zul, for that very kind introduction. I'm very excited to present this webinar, largely because of the really focus on, what is it called? So the focus on the early years and the lifelong approach. So as you've been told, the Institute for Human Development dedicates its work a lot to the early years. And in this talk, I really want to highlight in very simple terms how we can ensure brain health in the first 5 years of life. But if you follow WHO's work, you'll know that the early years span from conception to around 8 years, but in this area, I'll focus on the first 5 years. So in terms of thinking about the brain, one of the most important and critical aspects to really consider is the fact that almost 90% of our brain is achieved in the first 5 years of life. As you can see in this graphic, and we have put down for you a link where you can go and read a little bit more about how the brain develops. So from conception to birth, the child has 25% of their potential. And then the next 5 years, there is rapid development, which actually provides us a lot of opportunity to shape and build the brain, but also it's a period of a lot of vulnerability. So why is it that early brain health really matters? I think one of the most important set of empirical finding is really the fact that the early years shape lifelong learning, they shape behavior and health throughout the lifespan. Really, when you're thinking about the early years, what is important to think about is that they're foundational. So for instance, the skills the children achieve in the first 5 years of life will have long-term impact in the way they learn in schools, the way they achieve their academic work, but also in terms of productivity and also in terms of health and well-being. So if we are thinking about protecting the brain from a lifespan perspective, early investments are very important. And the earlier we start, the better our outcomes. And the other thing to think about is that how do we ensure adequate brain health in the early years? I will go into details about the foundation for brain health in the early years. However, if you remember nothing else from this talk, at least I would like you to remember two things. One is that when we are thinking about building the brain architect, and really optimizing it in the first few years of life, two things are important. It's really genetics. So the genetics really do contribute a lot to the way the brain develops, but also the environment. So together, there's quite a good interaction in optimizing the child's potential. The other thing to think about is really what now has become very popular in terms of very small acts in the early years can have big impact. So you'll see when I talk more, things like play and singing are day-to-day activities that really help to build and optimize the brain in the first few years of life. So what are the foundational things we need to consider? So in terms of ensuring optimal development in the early years, nutrition is very key. And here, the first one I would like to highlight is the breast milk, really because it contains varied nutrients that really support brain development. But actually, when you think of breastfeeding, it's not just the food they're taking, but also the opportunity to attach to the mother, to interact with the mother. So breastfeeding is really a core component. And as the children grow, a varied and balanced diet is very important. So we know that there's a lot of empirical evidence that childhood malnutrition will have lifelong negative impacts across areas like cognitive development, socio-emotional, behavioral, and mental health. So really, if we would like to optimize brain outcomes, we want to invest in good quality nutrition. And I know here I've started on breast milk, but actually we have to think about nutrition from the womb prenatally. The other thing is that really early learning opportunities. And we know when we work in the field, it's always amazing when we talk to mothers and tell them, even when the child is in the womb, stimulation in terms of talking, touching, all that matters. And when you think about the brain, one has to think of it like any other muscle. In the process of growing, if there are any connections not being used, the child will lose it. So we need to ensure that the child has an opportunity to explore, to be curious, to play so that they can build their brain. And then activities that the adults around the child really do with the child. For instance, talking to them, singing, dancing, reading a book, all this contribute to stimulating the brain and ensuring the brain develops optimally. We can't overestimate the impact of health. So if you look at childhood illness, they really can impact the child in terms of their growth and development. It could either be direct. So for instance, an example are infections like HIV. We know that HIV is neurotoxic. So the virus can actually impact on the nervous system and the brain directly. But also, some conditions actually have indirect impacts, or both direct and indirect. I'll look at malnutrition. So malnutrition has direct impacts on brain growth, but indirect impacts could be when the child is very malnourished. They can't play, they don't have the energy to play, they can't explore, and we know that children learn by exploration and by play. So, and also when you think about health, there's really a need for parents to take early preventive measures, and that is why WHO has a lot of recommended antenatal and postnatal clinics where children can be followed up and measured and really parents supported. And one thing about thinking about brain health, the beauty with active engagement with the health system is that children with developmental delays can be identified early. And what we know is that early intervention because the first 5 years of life, there's a lot of changes and growth in the brain. So if we implement early intervention early, then we are likely to have better outcomes for children who are showing developmental delay. Another important aspect for children is safety and security. So really, children's brain develop optimally when they're protected from physical and emotional harm. So physical harm could be things like being beaten, being exposed to conflict, like we are in a world with a lot of war, which exposes children to physical and emotional harm. But also, being in an environment that is toxic in terms of pollution, in terms of toxins in the environment. We know that, for instance, heavy metal exposure actually damages the brain. But, like when we work in the field, we tell parents, violence in the house, shouting and a lot of noise makes children feel unsafe, which is bad for their development. So there is one that I, in many ways, consider core to all other components, and I know this can be debatable. That is stable and loving relationships. When children have people who love them, whom they can rely on, and they feel safe, what happens is that they learn to manage stress. And when they manage stress, then it protects their brain. So the loving and responsive relationships are very good for building neural pathways. And really, caregivers are encouraged to maintain eye contact, touch, and conversations. And you can see here, I have talked of caregivers, really taking into consideration there are very many cultural contexts. So the mother and father in some setting are the immediate caregivers. They are setting whereby it's extended family. What is important is the child needs to really feel safe and to feel the stability in the environment. And really one of the most important aspects about responsive caregiving is being sensitive to the child's need. And that's why I look at it as a core component. If a parent is able to say, today my child doesn't look very happy, doesn't look very engaged, and really try to understand, they could pick up an infection very early and be able to address it. If a parent is very sensitive to the child clues, like when the child is talking to them, they respond to the child. When the child wants to play, they play along. And really, it's what the, people in ECD sometimes refer to serve and return. A process whereby when the child asks for something, you are able to respond to it early enough, and, the child feels their needs have been addressed. One other thing I would like to highlight is sleep. So sleep is very important for children. When children are sleeping, the brain is active. During this time, they will process experiences, consolidate memories, and really strengthen their neural connection. And there are various things parents and caregivers can do to encourage quality sleep, which could include things like ensuring there is a routine for the child. When it's time to sleep, you start reducing the amount of stimulation in the environment, ensuring there is a comfortable sleep environment, and really paying attention to the child's need for when they want to rest and sleep. So really, in summary, there are various things one is that the early years are critical. They're foundational. It's like building a house. If you have a good foundation, it's a good start to your house. So the first 5 years of life, we need to pay attention and really provide the foundational things that ensures optimal brain development. And the other thing to remember is that in terms of optimizing child development and their brain development, very small acts like singing to the child, dancing with the child, storytelling, ensuring they attend their clinics, they eat a varied and balanced diet, can have a big impact in terms of the long-term outcomes. Thank you very much. I hope I've stayed in my 10 minutes allocation. Thank you.
That was very good timing, Amina. Thank you so much for a very informative and an exciting presentation. And I think it's very important for people to understand how critically important those early years are. You're right, because that is the foundation that actually is what the brain builds on for the rest of its life, just as we develop. So if you want to learn more about Dr. Amina's work, we have links to her website that you can visit as well. Before I introduce my next speaker, let me just tell you a little bit about the hosting institution, the Brain and Mind Institute. The Brain and Mind Institute is essentially focused on brain health and mental health. That's our core focus. And it works across 4 pillars. One is research, because we're a research institute. The second pillar is innovation translation, where we actually change the way mental health is practiced in the community using evidence-based interventions, for example. The third pillar is education. We do a lot of courses that are public-facing, that build awareness. And the last pillar is partnerships, where we are really part of the community. We are not building an ivory tower. We like to say we're a big tent. We like to collaborate with people and academics across the globe, as well as locally, and the community organizations. So we talk about Brain and Mind Institute as being taking issues from the neuron to the neighborhood. So you can read about that on the link as well for our website. But now let me introduce you to our next panelist. That's Dr. Aisha Mia. As you can see from her bio that is being projected right now, that she is quite the force in the field. Dr. Aisha Mia is a founder and a CEO of an organization called Synapse. She works in the area of child and adolescent psychiatry with extensive experience in teaching, capacity building, program development in the areas of leadership, mental health, medical education, cultural intelligence, and gender. So she was one of the initial creators of the first adolescent psychiatry fellowship program in Pakistan. She is a distinguished fellow of the American Academy of Child and Adolescent Psychiatry, and she was awarded for her instrumental work in pediatric psychiatry. She is also a senior fellow of the Higher Education Academy UK, a recognition given to her for her leadership in the area of medical education. And you can, of course, read up more about her on the link that we have provided. But without further ado, why don't I pass the baton to her to tell us about the next stage of brain development and what to look out for and what are the critical factors. So over to you, Dr. Aisha Mia.
Thank you so much, Dr. Mirali, for the invitation to be part of this webinar with this amazing set of panelists. And hello to all of our listeners and participants over here. Really, really happy and honored to be here amongst all of you. So I'm going to talk a little bit about adolescence. I don't have slides. I think I do so much of this work that, I felt that I'll try to tell you a little bit from my experience, because most of the work, the clinical work, and my policy and awareness raising work that I do is with adolescents. A lot of people worry about adolescents. They find them a mystery. They find them problematic. A lot of parents will come to me and say, what do we do? They start getting anxious that my child is becoming a teenager. I really like to work with that population. So if I can, what I'll do is I'll break sort of the way what I'm going to talk to you about into sort of the key changes that are happening in the brain. And then, how those are sort of like linked to development. And then, just a bit of a summary of some of the things to really focus on and know about the adolescent brain. So as Dr. Amina talked about the brain development in childhood, by the time somebody becomes a teenager, the brain actually has almost reached its maximum size. It's grown in size. So no more growth happens. But what happens in adolescence is fine-tuning starts to happen, which is also called myelination. So the key changes that are happening, or the key developmental changes that start happening in the brain, as it starts to mature, are in three sort of priority areas. One is social interaction, the second is decision making, and the third is emotional regulation. So those are the three sort of primary areas that are getting pruned in the brain, that are getting sort of fine-tuned in the brain. Also, what is important to understand is that the brain starts maturing or myelinating, as we say, from behind, and then it starts to mature. Like that's the frontal part is the last part to mature. The part of the brain that's behind is basically used in our basic day-to-day physiological functioning, like balance and rest, breathing and all of those things. So that is why our eyesight and all, and that is why the myelination has to start from behind, so that our basic life day-to-day functions are taken care of, and then sort of the maturation comes forward. And the part of the brain that's right in front, which is the prefrontal cortex, is the last part of the brain to mature. And this is the part that is involved in planning or prioritizing or making good decisions. So whenever we say that our teenagers are not making good decisions, what's wrong with them? Don't they understand what's going to happen? It's because that part of the brain that should allow them to make those good decisions is really not matured yet, right? So it's important to understand that the prefrontal cortex, which is the last part to develop, is not quite mature. And that is why we see the increased impulsivity in our adolescents, and they're more attuned to just immediate rewards, and something that is going to happen right now and what might feel good right now, rather than long-term planning, because that's again happening in our prefrontal cortex. The part of the brain that does start maturing, because it is connected to social cognition, is what's called the limbic system, which is right in the middle of the brain here, our temporal lobe or our limbic system, which is actually involved in emotions and reward processing areas. So again, when we say that all our teenagers are people with big feelings, and they feel everything at a 10 out of 10, they're like excited and they're angry and they're sad and they take up all of these big causes, it's because that part of the brain that is involved in sort of social cues and social connectivity with their peers and with the rest of the world, and how am I connecting to different causes that people take up. So all of that is happening because that part of the brain is maturing. Also, the third thing that starts happening in the brain is what we call synaptic pruning. So synaptic pruning basically means that the brain starts to eliminate unnecessary connections in the brain, and making sort of finer connections, fine tuning those connections, and what happens with that is that the pathways are therefore made more efficient. So the unnecessary connections, as Dr. Meena told us, that a childhood brain is an open slate, so we add as much learning as we can into that brain. And with adolescence, we slowly start to eliminate what's not needed. So the brain is now beginning to get more specialized. It's beginning to get more efficient. And therefore, their ability to learn and adapt is actually beginning to become more mature. And therefore, in that stage, I think it's important, and children want to, take up more challenging classes, do new things, because they're now able to pick up and learn new things. Somebody was telling me the other day, which didn't make me feel good, because I'm nearing or have turned 50 myself, that the human brain is the smartest at age 18, right? So that's because of how all of that pruning that has happened, and their ability to learn is actually it's the brain is sort of the most plastic at that time. There's a lot of plasticity, so their ability to just take in and really and learn from a place of sharpness is at its best. And then, of course, the fourth thing that is happening is the brain, as I said before, is myelination, which is the fatty substance. It's called myelin, which is insulating nerve fibers, and it's basically improving speed and efficiency of communication between the different regions. So again, they really have this ability to learn new things, to learn them faster, to figure out better and more efficient ways of doing stuff. So the key developmental sort of changes that happen, because these are the 4 parts of the brain changes that are happening. So one, as I said, that there is a lot of increased plasticity. So they have this immense capacity to learn. This is the time when adolescents will be kind of, learning as much new stuff that's coming to them. They'll be reading classics. They'll be, learning about all of this, fascinating stuff that the world is bringing towards them. The second developmental stage that is so important, incredibly important for teenagers, is the social focus. Again, because the social cognition part of the brain is getting matured. So that is why they're more attuned to peers. They're more attuned to making connections with people outside of their home, much to the chagrin of their parents. So I think that is important. The third thing that happens in terms of development, which puts parents, make them feel very, very anxious, is risk-taking behavior. Because there is so much that's coming towards them, because they want to learn and try new things, they will take risks. And because their frontal lobe is not really mature, so they will do stuff that might appear to adults as risk-taking without thinking through of what the consequences might be. And that is why we see a lot of risk-taking behavior in adolescence. And then the last thing is the emotional sensitivity. Again, because they're the part of the brain that is immediately connected to social cognition and cognitively growing in the area of social interactions. Because of that, they tend to be very sensitive to different things that are happening around them. Everything seems like, it's like do or die sort of thing. Everything is like, it has to happen today, otherwise this will happen. And I have to go be with my friend because this is happening with them, or I have to. So they tend to be very sensitive to different emotions. And parents will often be wondering that it's not that big a thing, you can calm down. But that's not, that calming down comes from the prefrontal cortex, which is not quite mature. So if I can summarize, 7 things that are important to know about the adolescent brain. That one, it is an extremely important time for brain development. The brain finishes developing from mid to late 20s. So, your and my brain, I don't know how, if we have any teenagers and young adults sitting here, but the adult brain does not look like the adult brain until the age of 24 or 25. So, it's still maturing and it's still processing. And the specific part that is connected to planning, prioritizing, and making good decisions is not mature yet. So they're not good planners. They are not going to be able to prioritize things that an adult will be able to prioritize. And they will make risky decisions. The second thing is that social interactions, regardless of how much parents feel that they're always with their friends and stuff, that's what they need to do. That is developmentally the right thing for the adolescent to do, to make social connections, to move outside of their home situation, to see what else is out there, to find their own identity outside of their home environment. Third thing, brain is ready to learn and adapt. So as much amazing ability to adapt to different things, to respond to new experiences, and therefore taking challenging classes, exercising, engaging in creative activities like music and art. All of that helps strengthen those brain circuits and also help the brain mature. Also important to understand, I haven't spoken about that before, that teen brains also respond differently to stress, right? So because the brain is still developing, they are more vulnerable to stressful situations. They are very emotionally sensitive and they don't necessarily know how to regulate their emotions. So they're more likely to develop anxiety or depression at that stage. The other thing that parents get really, really upset about is that they don't sleep at night, or what they think is the right time to sleep. That is because the sleep hormone melatonin works differently in the teen brain. So melatonin's levels stay higher later at night in the adolescent brain than in the adult brain, which means that they're not ready to sleep as early as we would like them to be. So they tend to stay up till late. But because they often have to wake up early the next day for university, for school, for college and stuff, sometimes the adolescents may not get enough sleep, which also might lead to increased stress and increased anxiety. So it's important for parents to be and caregivers to be mindful about that. And then a couple of last things. One that is important to understand is that most psychiatric conditions, whether it's schizophrenia or bipolar disorder or depression, actually have their age of onset during late teens. So that is also the time that if someone has a genetic vulnerability to bipolar disorder or depressive disorder or anxiety disorder, or even schizophrenia, that most likely that is when they're going to present. So again, important to understand that as we look at what are the struggles that our teens might be going through. And the last thing that I will say is that the teen brain is very, very resilient, that despite these stresses and challenges that come with the adolescence, most teens will go on to becoming very healthy adults. And some of the changes, some of the things that they go through, some of the lessons that they learn because of their risk-taking behaviors might actually help support the building of resilience and mental health and wellness and how to deal with the issues that they've struggled with in the long run. So I'm going to end here, and I hope I didn't go over time. Thank you.
Great. Thank you so much. Very exciting and I think very informative, not only for the participants, but also for many of the parents who rightfully sometimes do not understand the behaviors of their young kids, adolescents, teenagers. And you said shed a lot of light on why they act the way they do and what parents should be looking out for and be more understanding of. So thank you very much for this brief coverage. We'll talk about some of the very other important issues that you brought up at the question and answer panel. But I would now like to move on to Professor Mohammed Vasey, who is a professor of neurology at the Aga Khan University, Department of Medicine. He's a consultant neurologist with expertise in general neurology and situations like stroke. He's honored with the Advocate of the Year Award by the American Academy of Neurology for global patient and neurology advocacy in Colorado. He served as a president for the Pakistan Society for Neurology, and he's been elected as a trustee of the World Federation of Neurology. And so he comes with a lot of experience and a lot of important information to share. So over to you, Dr. Vasey.
Thank you. Thank you, Zul. Thank you, BMI, for organizing this very important event. I think it's a very well attended, and I really appreciate the efforts of BMI for whatever they are doing for educating and doing research related to brain health across the global population, especially in Asia and Africa. There are no disclaimers for this presentation. Now, the important issue is aging population, because we are talking about neurological diseases and brain health. 80 to 90% of the neurological diseases and brain health challenges, basically they arise in population which is more than 50 years old. So now the global population is aging. 1 in 6 people in the world will be age 60 years or over in the next 4 or 5 years. And some countries, they are even aging more faster as compared to the other part of the world. North America, Europe, Japan, for example, Japan has 1/3 population which is more than 65 years old. And in 2023, Japan became the first country in the world who were selling more adult diapers as compared to pediatric diapers. And now a lot of developed countries in moving that direction. So the global population is aging, and because of this aging population, we are seeing more and more neurological diseases, and we will continue to see more and more neurological diseases and brain health diseases across globe. And because of this aging population and related brain health related issues, so what I have done, basically, I have selected some of the neurological conditions and issues which are affecting the elderly population, and we'll discuss one by one that how they are affecting our population and how can we take care of these issues in our elderly population. So stroke is the leading cause of disability and second leading cause of death across globe. It has known risk factors: hypertension, diabetes, dyslipidemia, atrial fibrillation, and air pollution. Now, mean age of stroke in Pakistan is very young, 57 years, as compared to Europe, where it is 70 years. And we have a very high mortality, about 40% stroke-related mortality in 1 year. It's a preventable disease if you can control the risk factors, and it's a treatable problem. So if you can do the acute stroke treatment, thrombolysis, thrombectomy, if you can provide stroke units care and stroke rehabilitation, so we can not only save a lot of lives which are being lost to stroke, but we can reintegrate these persons into community over a period of time. Now, after stroke, the second biggest problem which is going to be challenging for the population across globe is dementia and Alzheimer's disease. Alzheimer's is increasing in volume, and about 20 to 30% people who are 70 years old or 80 years old, they are suffering from Alzheimer's disease or other kinds of dementia. And that is basically these people become dependent over a period of time because it's a progressive disease, it's a degenerative disease. And so far, there's not much treatment to stop the progression of the disease. So it affects memory, thinking, orientation, behavior, and everything. So in dementia, dementia is also a preventable condition. So hypertension is a risk factor, hypercholesterolemia, diabetes is a risk factor, heart disease is a risk factor, smoking and tobacco is a risk factors. So these are all vascular risk factors. So then if you can control these risk factors, then you can not only decrease the prevalence of stroke, but also you can decrease the prevalence of dementia and vascular dementia or vascular risk factor related dementia across global population. So this should be a very important priority for population which have a younger population. If they want to prevent their future population from stroke and dementia, they should work on these risk factors. Now, in addition to dementia prevention, stroke prevention, there are certain strategies which you can use for dementia prevention, especially mentally stimulating activities, engaging in social and leisure activities, social networking, a Mediterranean diet, high intake of oxidants, and weight loss, because being overweight or obese is a risk factor for late onset dementia, and exercise. So these are certain dementia prevention strategies we should implement in our communities to prevent further progression and for dementia in the communities. Now, other than dementia, the other problem which is faced by the elderly population is Parkinson's disease, and this includes gait difficulty, slowness, tremor, change in voice. About 6 to 7% people suffer, which are more than 65 years old. It's a neurodegenerative disease with slow progression, and 30% develop dementia. It's treatable with medications. It's also treated with surgery in selected cases, and there's a very strong role of rehabilitation. You have to make sure that they don't fall, because fall can make these patients worse. And this is also not only a treatable condition, but you can treat them for a long period of time, for many years. And these patients can be healthy and can be very socially active if they are on the right treatment. So they not only need counseling and patient group support in terms of medication, but a societal support to continue the progression of their activities. Now, other than Parkinson's disease, another very important problem which is prevalent in elderly population is depression. It's a risk factor, and it's and manifestation of cognitive decline. It's very common. Up to 25% elderly population is suffering from depression. Sometimes it's hard to diagnose, and usually it presents as lack of interest, motivation. Sometimes it happens with loss of a spouse or a family member. It is also a very treatable condition with medications. You have to identify it and you have to treat it with medications. And sometimes you need psychiatric care and cognitive behavioral therapy by psychologists to treat depression and complications of depression. Another important problem in elderly is medication side effect, because these people are on multiple medications, and multiple medication use is common. So more side effects in elderly which are using multiple medications. So this is something you have to be very careful in using multiple medication in elderly, because they cause a lot of side effects. So number one, you have to every time review the list of medications. Number two, start low and go very slow over a period of time. Avoid over-the-counter and non-prescription medications. And even you have to control the multivitamin, neurotonic, sleep medications, allergy medications, pain medications in these patients. So this is a very important cause of morbidity and mortality in elderly population. Septic encephalopathy is also very common. It's because it's most common cause of hospital admission. Usually it's due to infections, UTI, respiratory tract infection, and usually it's very treatable with aggressive evaluation, blood test, hydration, and antibiotics. And it's a recurrent problem. So you have to keep an eye and you have to keep treating these patients again and again. Now, metabolic encephalopathy is also another problem. Usually electrolyte imbalances, liver dysfunction, renal dysfunction, sometimes dehydration, anemia, which is like low hemoglobin. And it's a common cause of altered mental status and is easily diagnosable by blood test and clinical evaluation. So this is something in elderly, if they are having altered mental status issues, then you have to keep an eye and you have to treat this metabolic encephalopathy. Now, epilepsy is also common in elderly. Usually epilepsy happens in two ages, like young ages and elderly. Up to 3 to 4% of elderly have epilepsy. It's more common in stroke, neurosurgery, and brain trauma patients. And it's also a very treatable condition. You can treat this problem with the long-term medications. It has some potential side effects, but you can control the side effects by just controlling the type of medication. Now, there are very good anti-epileptic medications with little side effects and very good efficacy to control epileptic seizures. Now, another important problem is fall-related injuries, which can lead to traumatic brain injury and spinal cord injury and nerve injury. So falls are very common. Hip fracture is very common, head injury and spinal cord injuries. So a lot of time these are preventable. So you have to make sure that elderlies don't fall and don't develop any fall-related injury. Now, if there is a fall-related injury, then it takes a long time to recover, to 3 to 4 months. And so fall precautions and gait evaluations, you have to avoid darkness and treat visual problems to avoid falls. Now, palliative care and end-of-life care is an important issue for elderly population, especially for bedridden patients with chronic illnesses, stroke and cancer. A lot of patients, they need to be on comfort care. And for those patients who are bedridden and in hospital or at home, you have to avoid bed sores, you have to provide good nursing care, feeding, you have to provide good exercise to avoid contractures, judicious use of medications, family counseling, and realistic goals and home care services are needed for these patient populations. So in conclusion, there is a growing elderly population across globe, including South Asia and Africa. And a lot of time, you could prevent a lot of neurological diseases and psychiatric diseases by just implementing preventive strategies. You can improve the quality of life of these patients who have neurological disease, but they could have a very good social and active life. Early diagnosis and treatment is important, and rehabilitation and assistive devices are important. For long-term care, I think you have to set up realistic goals and counseling for these elderly population. Thank you very much.
Thank you very much, Dr. Vase. This was very eye-opening, and I think that you're right. It's interesting that although in the low and middle-income countries, the youth are by and large majority of the population, because of the better control of the communicable diseases, people are starting to live longer and longer, even in the low and middle-income countries. As a consequence, the population of people over 65 in the low and middle-income countries is literally exploding. And so there's diseases of, and the conditions, brain conditions in older populations is also in parallel increasing very rapidly. So very interesting overall presentations. Thank you to all the panelists. I think that we will now begin to start taking some questions from the participants, and yeah. So maybe before we start taking the questions, maybe I'll ask the panelists to comment very briefly on what they've heard across the spectrum, and then we'll start taking questions.
I think really interesting discussion from all the panelists. I think the key takeaway for me is that at different ages, the needs change, However, we do have a lot we can do to care for our brains. day-to-day things to do to care for the brain to ensure it remains healthy. But we have to be aware of the, changes that happen with age and really address people's needs. Like the early childhood needs may slightly differ from adolescence and from aging. So being aware of really the lifespan changes as the brain ages.
Thank you, Amina. So maybe, one of the things that I don't know necessarily about a key takeaway, but something that struck me really was, how at every stage in life, especially for brain development, there's such a major role for the caregiver. So, it's like with Amina as well, of course, with childhood development, I think that is an absolute essential. As we talk about adolescence, and that, the caregivers also then start changing. So it could be the parents, but it's also sort of the teachers and the mentors and the people, the elderly folks around, the elder folks around those adolescents. And as we become adult, I think it's the same thing that, we, whoever is around us, especially as people get older, I think that that role of the, it's like the village that is helping people stay healthy or their brains stay healthy, just keeps becoming more pronounced. So I think that and also one of the other things that I was thinking about is that, we talk about illnesses and we talk about things, the challenges, but there's so much that needs to happen and continues to and is important for us to work on in terms of the mental health and wellness part of it. So, rather than focusing on the disease, which when it happens, yes, it happens, but there's, the preventive stuff, I think is definitely something that societies and, we all as healthcare workers, but general societies at large as well, need to plug a lot of input into sort of keeping the brain and healthy, which then, absolutely one of the things that becomes important is to just take away the stigma around mental health and wellness, and then also illness, but work in that space.
Yeah, no, very important points. And I think that's a thread that continues across the development. I think this area, Dr. Amina talked about it, Dr. Vase talked about it, so did you, in terms of what we should be doing to kind of prevent injuries to the brain happening and to keep the brain healthy and thriving. It's so important right from the get-go, from even before a child is born. We need to kind of nurture the brain right ahead. And I think that when we look at the medications, for example, for different health conditions that come our way, it takes a long time to kind of get to us in an affordable way in the low and middle income countries, because most of the medications are being developed in the global north. And so I think that what we have, something that we can all do right from now, is prevention and promotion. I think that has probably the biggest bang for the buck, if you want to say it that way, to actually make a difference for our population. So that's very important. Dr. Vase, did you want to say a comment?
Sure. Global burden of neurological diseases is increasing. A recent GBD study reported that 1/3 of the global population is suffering from one or the other neurological diseases, and that burden is increasing. So a lot of times you have to not only treat these patients, but I agree that, in developing countries, especially where we have a higher younger population and high volume of younger population, you have to start preventing strategies for these younger populations so they don't develop these neurological diseases. Most of these neurological diseases are treatable and they are preventable. So you have to adopt like lifestyle modifications and strategies to improve the prevention and decreasing the burden of neurological diseases in low and middle income countries. I think that's going to be very important strategy. And that's the whole idea and purpose of these kind of webinars, is to implement those strategies.
Yeah, and that's fascinating, because I think that up to a few years ago, we weren't quite sure whether these disorders, particularly the dementia, can be prevented. And now we know that 50% of dementia can be prevented. And so what is important is that, that we understand what are those modifiable risk factors that we can actually implement in our communities, because they don't necessarily have to be the same that are effective in the global north, for example. And so we're doing a study here at the Brain and Mind Institute that is focused, called Fingers Africa, which is a project whereby we are trying to identify what are those modifiable risk factors that would protect people from developing dementia as they age. And so once we understand those modifiable risk factors, we want to actually implement them in a clinical trial to see whether can we avert onset of dementia and things like that. So I think that, yeah, that's a very important area of focus. But now I'm going to open it up to questions that we'll be getting from the participants from the audience. And one of the questions is to do with the symptoms of mental ill health. Does mental ill health, for example, depression, express itself in the same way across the lifespan, although as Dr. Mia said, it begins in early teens or teen years to manifest itself, but it can manifest itself in adulthood or can continue, and even in the elderly. And so the question is, does it look the same, or how do you recognize it?
So I could take that, Zul. So no, it expresses differently. Even if you're looking at children and adolescents, it expresses differently in children and in adolescents. So in children, depression. So in infants, for example, people used to say that how can infants or little babies become depressed? But if there's, let's say, they don't have the kind of care that Dr. Amina was talking about, there's neglect and stuff, then infants can also exhibit depression, and that shows up in terms of failure to thrive. They're not meeting their milestones. As they grow older, there could be a regression in the milestones that they've already achieved. So somebody who has, let's say, become potty trained will start to wet their bed at night, go back to, regress in their behavior. So there might be some regression. In terms of just mood changes as well, children under 10 are rarely going to look sad. They're more likely to be more irritable. And depression in children under 10 will manifest more so in terms of, let's say, changes in pattern of behaviors. Like, let's say somebody was an extrovert and wanted to go out and will now say that, no, I don't want to go out anymore. I just want to stay in my room. Or academic decline. So let's say, they used to be grade student and now suddenly they're failing in their classes. So those changes in pattern, we see them more in little children. Adolescents tend to be a lot more, and invariably I will have parents saying, oh, they're just always irritated and bothered and sad and cranky and angry at home, but then they go out with their friends and they're all right and they're laughing. But that's not quite that it doesn't mean that they're happy and they just don't like the parents. It is most of the times, if adolescents, teenage depression, teenagers will mask that depression when they go out to meet people, because as I said, socially, that's a priority for them. At that age, for their brain, social networking is a priority for them. So they will find whatever they have in them to be able to manage that. But at home, they will, again, they will have more neurovegetative symptoms like changes in appetite, changes in sleep, psychomotor retardation, again, changes in pattern and anger or irritable outbursts. It's, again, very rare to find teenagers just sad, depressed, or having increased crying spells. Adults will then start showing what the DSM will really show as the sort of SIGI caps, the signs of depression, like sad mood or hopelessness, helplessness, and all of those other things that come with it.
Thank you. The other question that we have from the participants, one of the questions has to do with what impact does this amount of screen time have on brain development and behavior? Do any of the panelists want to take that on?
Amina, do you want to
Because-
start with under 10 and then maybe I can add the adolescent piece? Do you want me to take this, Zul?
Sure.
Okay, all right. So, again, this is such a big topic. We can have 3 webinars on just social media and mental health. And it's a very, very big thing. There's just recently a big study that came out that showed that social media use can actually lead to increase in mental health issues in children and adolescents. So I take a bit of a nuanced view to it. So screens are there to stay. Screens are not going anywhere. So I think that it's important to work from the space of that this is a new reality that is part and parcel of our children and the future generations as well. So what needs to happen is that both parents and children and schools and kindergartens and everyone needs to start teaching social media hygiene or screen hygiene, as I say. So, for example, when we were little, our playground was outside, and our parents would say, "Go out, play, but come back before dark, or come back, as the sun is about to set." And it's the same kind of thing. I think that at every stage in life, there needs to be some sort of limitations and structure that needs to be placed around screen time and social media use. That what are children watching when when our children would go play outside, we would want to know who they're playing with. We would want to know who are sort of their peers or their friends. If they were going to friends' houses, we wanted to know what are their parents like. And it's exactly the same thing when they're on social media. As parents and caregivers and school teachers and everyone, we have the responsibility to know what they are watching, to what extent are they watching. And then with age, you kind of, allow the sort of permission to increase that use. What is also important to understand is when I say that what are they watching? So one of the worst things on social media are these like short reels that keep coming. And I see so many young kids, like 6-year-old, 7-year-old watching YouTube, and they're going from 30-second reel to 30-second reel to 30-second reel. One, it's got horrible stuff that comes into it, like all sorts of weird stuff, but also it's not helping your brain develop attention pathways. So watching a movie, for example, for an hour and a half is actually pretty okay because kids have to pay attention and see what is happening and follow the plot and follow the emotions and follow the storyline. And that is better. So that kind of screen time, even if it's for an hour, hour and a half, is actually much better than them just scrolling mindlessly on Instagram or on YouTube. So I think just teaching that kind of social media hygiene, social media etiquettes, screen time etiquettes, and then also knowing what they're doing and actually getting involved with your child rather than telling your child or teenager that this is bad, horrible, stay away from it, the monster, this, that. I think it's important to learn about it and then, be curious and ask our children, what are you doing? Can I join you? How do you make a TikTok video or whatever? And so that you are engaged with their social media use.
Right. Thank you.
I think
Dr.
what I
Meena,
can
is it-
tell about the elderly population that because we think that social media and screen is a pediatric issue and it's an adolescent issue. Actually, it's an elderly issue because there was a recent study showed that average time is spent by Pakistani men and women on social media is 4 hours. So 4 hours is a very long time. It's kind of an addiction. If you just turn off the Wi-Fi, you will know that how people become groggy and how people start fighting if you just turn off the social media. So social media is an addiction. I'm seeing a lot of patients who are addicted to video games. They play like games all night long. People sleep late at night because they are on social media for 3, 4, 5, 6 hours. So it's a major problem. And now the problem is even elderly population, like 60s and 70s. They are playing video games and they are playing Candy Crush and all those kind of things. So there are 3 things which I think that we should do as physicians. Number 1, we should ask all the patients that how much time they spend on social media. The other thing which is important is that what they watch, because the timing is important, but the content is also important. And a lot of time the content makes them, kind of depressed and sometimes angry and frustrated. A lot of content on the social media. So these are many things which we have to take care of when we are dealing with the social media and screen time. It's not only the time, it's the content and how they have to modify their habits, especially the sleep time and the daytime, what time they should use social media. So these are some important factors which are affecting our mental health and brain health, and which we should basically have kind of guidelines, and we should have some kind of recommendations that how you should be use social media to improve your brain health and cognitive skills.
Thank you so much. And Dr. Amina, I think your audio is coming on now.
Something on? Oh, sorry.
Go ahead. Yes, I was just saying that you can take the mic.
Oh, okay, sorry, I had challenges with my mic before, but I agree with both speakers. And I say for early childhood, you know, screen time that is moderated, it is structured and engaging and limited is not bad. But when it's excessive and very dull without any engagement, that is bad. Because we know that children learn best by playing, by being active, by being out there. So too much screen time makes them not learn social skills. It denies them time to actually be physically active. But we know that there could be some very educative, engaging material. If it's very moderated, very limited, it could be beneficial. But as both speakers have spoken, it's very important to know the content, the amount of time, what they're engaging in, and really for early childhood being very limited so that they have more time on physical activity, social interaction, and exploring their environment.
Yeah. Yeah, and I think that that's very true. And I think that you were also mentioning that disruption of sleep is a very negative influence, and the screen time competes with the sleep time very often. And so that might be another factor that comes into play. So many countries, such as Australia, have brought legislation into place limiting the use of young kids to exposure to social media. And so that's something that's being debated across many different countries as to what really how to handle this new crisis that's coming our way. I'm going to get maybe Gloria to share questions from the questions from the participants for specific panelists. All right, so we have a question for each one of you, again from the audience. So you may take it as you wish. Dr. Amina, did you want to begin?
Yes, I'm happy to start, and that's a good question. IHD is having a whole webinar on paternal well-being and child development in the next few weeks. So I think we'll discuss this in greater details. Two things I would say. There is empirical evidence and ongoing study on paternal nutrition, and especially in relation to sperm quality. Yeah? But also one thing to think about paternal nutrition and child development is really around the different trajectories. For instance, very early on, children will learn eating habits. The things we teach them to eat early really becomes embedded in them, and therefore good eating habits for the whole family are very important. You know, so other than the direct pathways which people are studying, we need to think of paternal involvement and paternal well-being holistically in the way it influences the way the family will eat and which eating habits the child will pick. Thank you.
Thank you. Dr. Aisha, there's a question for you there.
Right. So the question is, how does early exposure to anxiety and depression in the teen years affect their full brain development by the age of 25? Look, so it's important to first understand that anxiety and depression, so depressed mood or anxiety, are also normal functions of the brain, right? So like one of the primary emotions is sadness, and fear is another primary emotion. So as long as they are within a range, so they also serve a function. So if somebody has an exam the next day, they must feel anxious because that makes them study. Or if a teenager is going to lose a pet, or will have a girlfriend or a boyfriend break up with them or something, they will feel sad, and that's a normal function of human brain. So those are all good things as long as your adults are in the support network is able to help you process them, understand them, and then also figure out that how does your body best respond to whatever coping mechanisms that you're using. and it's different for different people. So for someone who gets very anxious, maybe going and playing some music might be helpful. Another person might say that I want to go play tennis and I feel better. So I think it's important for teenagers to start recognizing that. Clinical depression, like an anxiety disorder or a depressive disorder, again, very important. I want to plug something in here for early detection, which is very important. Globally, from a time that a child starts feeling their first symptom of any mental health disorder like anxiety and depression to the point that they actually get clinical care, there's an average of a 6 to 10 year gap. So a lot of these adolescents, late children and adolescents are actually sitting with symptoms that are just totally not addressed, and they start addressing it themselves by maybe smoking weed, or they will start drinking alcohol or stuff like that, or get into other risk like taking behaviors because they're trying to manage those clinical symptoms. So as long as those are picked up early, they get help, and the help could be multiple things. The help could be exercise, the help could be therapy, the help could be medications if they're needed. As long as they get a help, they should be fine. As they become adults, it's not a problem. But if there is no help available for them and they learn to manage these things through negative coping mechanisms, that's when these things continue in their adulthood.
Thank you. And Dr. Vase.
Next question. Yeah, I think this is a very important and valid question. So there is a definite link between when you age, so you have increasing health risk and the cost goes up. And it is now understood that with the current trajectory of aging population, a lot of healthcare systems will become bankrupt over a period of time because they will have no money to provide care, because stroke care is expensive, Alzheimer's care, Parkinson's care, fall-related care. So they are all expensive cares. And if you are providing care to elderly population with these illnesses, then you don't have any funds for your healthcare system. Even the families become bankrupt because of these illnesses. So this is why I think this is so important to do the preventive strategies, because prevention costs less. And if you can, invest whatever you are investing on tertiary care right now, maybe 10% of that investment in primary prevention of these neurological diseases, I think you can save about 30 to 40% cost, which you are going to do in future for the tertiary care and secondary care of these problems. So this is a very important issue, and a lot of health experts and health economists, they are working on it. A lot of ministries and the governments, they are working on it, that how they are going to handle this problem in future.
Thank you. Thank you very much. And I think we'll bring the webinar to a close. I just wanted to make a couple of overarching comments. You've seen from the panelists how dynamic the brain is and how sensitive it is to different factors across the lifespan. The brain is very, very plastic, as you know, because there are all kinds of processes underway that can keep it flourishing. For example, we talked about myelination, which is like insulating the neurons of the nerve cell. We talked about sprouting of the synapses. We talked about neurogenesis, the birth of new brain cells. The brain is constantly evolving and changing, and is very sensitive to some of the social stimuli, to stressors, to nutrition, to drugs, and all kinds of stuff that can influence the trajectory of the brain health. And we need to really be very mindful and just like we look after our bodies, look after our looks, we need to pay much more attention to the nurturing the brain. Because as Dr. Amina mentioned very early on, is that the brain is influenced not just by the biology, but also by the environment. And the two of them are powerfully influencing how the brain evolves and grows and flourishes. And so it is very important. But on this occasion of the Brain Health Day, we wanted to focus on the brain to say that we need to pay attention to our brains, because we are our brains essentially. And if we don't look after it, the consequences are quite severe. And as Dr. Vase was saying, very often later on in life, you'll pay the cost if the brain is not well tended to. And along the development trajectory, there'll be many implications. If you don't look after the brain, your own growth trajectory will be impacted massively. And so there are so many questions. Thank you for all the participants and the panelists for a wonderful session. Unfortunately, we couldn't answer all your questions. There are literally scores of questions, and we'll try and answer you directly, and we'll share it with the panelists as well, and they can maybe provide you with some of the answers. There were all questions about nutrition, about drugs, about many different issues that they wanted to learn more about, things like neurodiversity and so on and so forth. So we couldn't answer all the questions, but it sparked enough interest and excitement. And I hope we walk away with the message that looking after your brain is very important, no matter what stage in your life. So with that, I'd say thank you to the panelists again for a stimulating presentation. Thank you. And the participants, you stuck on for a long period of time. So thank you and welcome to everybody.